Hello, hi, namaste everyone. This is Apurva Naik and welcome back to my YouTube channel Asana with Apurva Naik. In this particular video, we are going to discussing about enzymes that we are using as a biomarkers. Previously, we are discussing some proteins that we are using as a biomarkers. In this particular video, we are discussing how the enzymes that we are using as a biomarkers. So first of all, we are going to discussing what is exactly the enzymes is. As we all know, enzyme is nothing but it is a biocatalyst which increase the rate of reactions. So in our body, there are the different types of enzymes are present. For example, we require an enzymes to breaking down the food, to clotting the blood, and various other processes we read enzymes, and they are present in every cell and organ in our body. So how we are going to use this particular enzymes as in biomarkers? So enzymes are present in the specific tissue or a specific organ. They are the specific to the cell or specific to the organs. Means the kidney having a specific type of enzymes, the liver also contain a specific type of enzymes, our stomach contain a specific type of enzymes because this particular enzymes having a specific role in the specific organ. So we using this enzymes as a biomarkers in a such a way that if the enzyme can leak from the cell into the blood when that organ is damaged or injured, or they're having some diseases in this particular type of organ. So this activity and the concentration of the enzymes in the blood that indicate the source or severity of the cell damage. So for example, if there is some damage in the heart, then specific type of enzymes are present in higher amount in the blood. So we can indicate that there is some heart injury or there is some heart damage in that particular type of body. So this enzymes we are using as a biomarkers. So let's see one by one. Enzymes are the proteins that aid a chemical changes in your body and speed up the metabolisms. So enzymes is nothing but they are also proteins which doing some chemical changes in our body, doing some chemical reactions in our body and speed up the metabolisms. So our body having a thousands of enzymes that perform the unique functions. An enzyme marker is a blood test that measure the level of specific enzymes in our blood that can indicate the tissue damage or a diseases. So what exactly we are doing or we are using an enzyme as a biomarker? Simply we are take a blood test. In a blood, if particular type of enzyme level is so high than the normal, then we indicate that there is some tissue injury or some diseases in this particular body. So musculoskeletal diseases, organ damage and injury can cause an enzyme to leak from cell into your blood. So if there are some heart injury or there is some liver injury, from the liver these enzymes are come into the blood. So simply these enzymes are present in higher concentration in the blood that indicates there is some liver injury in that body. So use enzyme marker test for different purposes. हम different enzyme markers use करते हैं for the different purposes. The first one is a screening. As a part of the routine, so there is a various person who are doing the routine test. So in that case also we are using an enzyme as a biomarkers. So as a routine physical examination, an enzyme marker test can be identify the potential problem like organ muscular damage or there is any stress in the particular body. Second one is diagnosis. You may be get an enzyme marker test to diagnose the specific diseases or a heart problem. So the particular person who are having an heart issues. So in that case, we are doing this enzyme marker test or we are using this enzyme as a marker for the diagnosis of the heart problem. Third one is a monitoring. Test result can be shown if the treatment is working or if medication are damaging the organ. So if the person, जो भी person वो particular treatment ले रहा है और वो कोई medications ले रहा है, तो वो medication उसको help कर रहा है या और damage कर रहा है उस organ को, ये check करने के लिए भी हम enzyme as a biomarkers use कर सकते हैं. So there are the mostly two types of enzyme markers that we are going to discussing today. The first one is a cardiac enzyme test, that particular enzymes which are specific to the heart. Second one is a keratin phosphokinase, that is the enzyme which is most commonly related to the cardiac diseases. So keratin phosphokinase, we can simply say that keratin kinase also for this particular enzyme. So CPK isoforms or a keratin kinase, so include a CKMB, CKMM, CABB. So इस टेस्ट को किराटिन फॉस्फोकाइनेज टेस्ट CPK ऐसे भी बोलते हैं. सेकेंड वन उसको किराटिन काइनेज टेस्ट ऐसे भी बोलते हैं. उस किराटिन काइनेज के 3 टाइप्स हैं. किराटिन काइनेज MB, किराटिन काइनेज MM एंड किराटिन काइनेज B. So what is MB, MM and BB that we are discussing. And second one is the liver enzyme test. So liver is ALT and second one is the AST. So these two enzymes that we are going to discussing. And third one is an alkaline phosphatase. This is also an enzyme marker that we are using for the liver damages or for the liver damages study. So let's see one by one this enzyme. The first one is a cardiac enzyme test. So as we know, cardiac means whatever the enzyme which are related to the heart, that we are saying as a cardiac enzymes. So cardiac enzyme test check for the sign of heart muscle damage followed a heart attack or any another heart problem. So if the person who some heart issues or a problem, in that case the person is going to examine by this cardiac enzyme test. So when your heart experiences damage or a stress due to the lack of oxygen, it releases the substances called as a cardiac enzyme into the bloodstream. अगर किसी पर्सन को हार्ट इश्यूज है तो उस पर्सन में पर्टिकुलर एंजाइम्स जो है, जो कार्डियक एंजाइम है, वो बहुत ज़्यादा अमाउंट में उसके ब्लड में मिलेगा एज कम्पेयर टू healthier persons. So which are that enzyme? That's same. So an enzyme marker test is a blood test to measure the specific biomarkers in your body. So high level of cardiac enzyme can be a sign of heart attack or a stress on the heart. So अगर उस में ज़्यादा अमाउंट में कार्डियक एंजाइम उसके ब्लड में देखा जा रहा है, तो देर इज़ अ साइन कि दिस पर्सन हु आर सफरिंग फ्रॉम द हार्ट अटैक इन some years and in some days. So that particular CPK, that is keratin phosphokinase, which are the cardiac enzyme which are present in higher level in the blood if the person who having an heart damage. So normal level क्या होती है उस CPK enzyme की? So normally 10 to 120 microgram per liter. These are the particular normal level of that particular enzyme present in the healthier person. If this level is going to be increased in the blood, then it's said that this person who having a heart damage. So major cardiac marker levels too, हम क्यों इस पर्टिकुलर कार्डियक एंजाइम लेवल को मेजर कर रहे हैं. द फर्स्ट थिंग इज दैट स्क्रीनिंग ऑफ हार्ट डैमेज और अदर प्रॉब्लम. अगर हमें हार्ट डैमेज प्रॉब्लम को स्क्रीन करना है तो हम इस पर्टिकुलर एंजाइम को एज अ मार्कर स्टडी करते हैं. सेकेंड वन इज डायग्नोज द हार्ट कंडीशन that causes symptoms like chest pain and shortness of breath. So if person who are suffering from chest pain or who have not taking a particular comfortably breathe, so that person may doctor may suggest that you should be go for the cardiac enzyme biomarker test. And third one is that it can be also assure uh, heart function after surgeries like corneal arteries bypass grafting or angioplasty. So if the person who having an angioplasty or who having an particularly CABG surgeries, so after that surgeries also this biomarker tests are done to screening the particular patient's health. creatine phosphokinase test. So that is also a cardiac test itself, but we can say that here we are discussing about the types of CK, that is creatine kinase. Creatine kinase which having a three types mostly. So creatine kinase is an enzyme that found in the skeletal muscle, heart muscle, and brain. So creatine kinase itself having a three types: creatine kinase MM, creatine kinase BB, and creatine kinase MB. So these are the three types of creatine kinase. So we can say that particularly creatine kinase an enzyme which found in the skeletal muscles, heart muscles, and brain. So mostly creatine kinase are found in the three organs. They are present in muscles also, they are present in heart also, and they are present in brain also. So when any of these tissues are damaged, they leak a creatine kinase into your bloodstream. So elevated creatine kinase level may be indicate muscle injuries, or they may be indicate brain injuries, or they may be indicate a skeletal heart injuries. So there are the three types of CK enzymes are present. First one is a CKBB, that we also called as a CPK1, that is creatine phosphokinase 1, or we can say that creatine kinase BB. So why it's called as a BB? Because they are present in the brain tissues, so itself is called as a creatine kinase BB. They are found mostly in the brain tissues and lungs. So creatine kinase BB or creatine phosphokinase 1, which are mostly present in the brain tissues and lungs. So if CPK1 are present in higher amount in the bloodstream, then we indicate that there is a brain tissues injury or there is a lung injury. So if this biomarker, that is CKBB, we are using if there is a brain cancer, they indicate there is a brain injury, or they maybe indicate there is a pulmonary infractions are there. So if these conditions we are want to screen, then we are using a CKBB or CPK1 as a biomarker. Second one is a CKMB, that we also call as a CPK2, but it is called as a MB because they are present in the heart muscles. So high level of CKMB enzyme are most likely form of damage to your heart muscles. So this damage is often caused by heart attack or inflammation in your heart muscles. So but other conditions may be also cause a higher level of CKMB, such as blood clotting in the lungs, heart surgery, hypothyroidism, and kidney failure. So if these conditions are also present in our body, so there is a chances there is a CKMB enzymes which are present in the higher amount in your blood. So this mainly this biomarker which are using for the heart injuries. But if there is no there is a supplementary particular conditions may be developed if this person having a blood clot in the lungs, heart surgeries, hypothyroidism, or kidney failures. If these conditions are also present in the body, there may be chances कि CKMB will be present in higher amount in the blood also. And third one is a CKMM, that is also called as a CPK3, which are mostly present in the skeletal muscles. So if there is a higher level of CKMB enzymes are most likely to form a damage to your skeletal muscles. This damage may be from a disease, sudden injuries, certain medications, or recent instant exercises. So if muscle damage, any type of muscle damage will be done in the body, there is a higher level of CKMM which will be present in body. So this three types of particularly creatine phosphokinase test we are doing, that is CPK test we are doing. So this is all about creatine phosphokinase or creatine kinase. The second one is the liver enzymes. So if we want to study about the biomarkers. So liver biomarkers are the blood tests that help to assess the liver function, monitoring the liver diseases progression, or detect the liver injury or dysfunction. So this liver biomarkers we are using for the specifically for the study the liver functions are well, to monitoring the liver if the person who are going for the surgery of liver. So we just using a monitoring the liver disease progression or liver disease recovery if the person who are taking some particular medications. So in that cases there is a two types of particularly three types of enzymes that are mostly used as a biomarker transferase, that we also called as a ALT. The normal level of particularly ALT enzymes, which are differ in male and females also. So normal level is, in the case of male, it is 29 to 33 international unit per liter. In the case of female is 19 to 25 international unit per liter. So this is the normal level of ALT. If this particular level is exceed, then we say that this person having a liver damage. So as a SPGT test. So SPGT stand for serum glutamic pyruvic transaminase test. So this test is specifically done for measuring the alanine aminotransferase. So this enzyme is considered a gold standard biomarker for the liver injury. However, ALT level can also increase in a patient with muscle injuries. So it can be used to confirm the liver injury if patient also having a muscle degenerations. So one thing is that, okay, this ALT that we are using specifically for the liver injury, the person who having a small amount of the same person that we are using for the liver injury testing, and that same person who having a muscle injuries also, in that case we are not using an ALT as a biomarker, because in the case of muscle injury small amount of ALT is also released in the blood. So in that cases, the person who having a muscle injury, we are not using an ALT as a biomarker, but the person who not having a muscle injury, in that cases, this particular alanine aminotransferase, which is a gold standard biomarkers that we are using for the liver testing. Second one is the particularly aspartate aminotransferase. So aspartate aminotransferase who having a level about 10 to 14 international unit per liter in men and 9 to 32 international unit per liter in the female. So these are the normal level present in the liver of AST. Like ALT, AST level is rises when liver cells are damaged. However, AST is less specific to the liver because they are also found in heart, muscles, and other tissues are also. So ALT is more specific. AST is also using, but there are also some amount present in the heart, muscles, and other tissues also. Then after that there is an alkaline phosphatase. So alkaline phosphatase level is increased with the liver and bile duct diseases. Elevated ALP can indicate the bile duct obstruction, liver damage, or conditions affecting the bones. So in these conditions, ALP level is increases in the body. The alanine aminotransferase, that we as ALT, which is considered as a liver biomarkers, but along with that, if this level is increases, means ALT level is increases, so that is also the conditions, like it will be indication of, in the case of female, there is a polycystic ovary syndrome, means there is a PCOS conditions, if there is a present in the female who having a large amount of alanine aminotransferase. So alanine aminotransferase is also considered as a biomarkers for the females who are suffering from the PCOS conditions. So these are some biomarkers that we want to discussing with you is this. First one is the cardiac biomarkers and second one is the liver biomarkers. I hope you understand this particular two topics. Thank you so much for watching this video. If you like this video, please don't forget to subscribe my channel. Thank you so much.